a study was done, and it was done, I don't remember the town, but a small city in South Korea. What they did was they used a screening tool on every child in the city, and then if they looked like they might have autism, they went and did an actual interview with them, so that they diagnosed every case of autism in this small city. And that had not actually been done before. This type of, they call them ECA, epidemiologic catchment area study, they're very hard to do because you have to interview everybody, you know, either with a screening tool or with a face-to-face interview. But they just did that and came out with the results, which stunned everybody. They found that there was an incidence of autism in this town of 2.6%. And the reason this is a big deal is people have thought for years that the incidence is around 0.5%. And so basically, what this study is saying is there's 5 times as much of that out there as we thought. Now, obviously, a question is, how did they all get missed? And one thing is, through the years, originally when we talked about autism, we were talking about what people now generally kind of call core autism. Those people with really profound impairments. Over the years, that's kind of crept out and it's gotten broader, and we've kind of realized there's people who have a little bit of it. And that term, I've seen it through the years in the literature called nonverbal learning disability, called Asperger's syndrome. The current accepted nomenclature is autistic spectrum disorder.
What are some signs that they use or look for to diagnose autism?
The thing about autism, basically, if you're going to put it down to a sentence, it is a disorder of human relatedness. And that's the key thing that's present in all, you know, different types and levels of autism. Is there's something that's different, not quite right about how they relate to others. You know, the classic things are the thinking of other people as objects. They don't have empathy. They can't understand another person's feelings or stance, which is kind of a thing that, you know, kids are picking up. You know, by the time you're 3, you're starting to pick up, you know, kids can understand if I bite Sally, Sally cries, and she feels like I do when I cry. Kids with autism have a lot of difficulty with that. They tend to be very rigid in their thinking. Sometimes they've been called, the kids with Asperger's get called hyperlogical, different things like that.
As a parent of a young child myself, I've read a number of different articles and books saying these are the symptoms you should look for even in your newborn. What are some of those?
Caution people about getting too worried about this at a real young age, but they have worked on developing tools that you could recognize signs of autism as young as age 2. But basically what you're noticing is a failure to engage the way a baby and toddler normally would. You know, not making the eye contact, interacting. It's tough to make the call at a really young age like that. By the time they're school age, it's much easier to tell.
What role does genetics play in autism?
You know, the genetics of autism is very interesting, and they've been learning tons more about it in recent years. In fact, the geneticists tend to speak of it as a plural now. They talk about the autisms, and there's, off the top of my head, more than 8 specific genes that are associated with developing autism. But the thinking is that each of them is creating the likelihood of a syndrome that is a type of autism, but that they're not exactly the same thing. So there's kind of a final common pathway is the language the researchers would use. And there's different things that can lead to it developing. And so these folks don't all have exactly the same syndrome either.
If someone is diagnosed as being autistic, what form of treatment is available to help them?
The treatment, a lot of it depends on how impaired a person is. If a person's, because most of the people who have an autistic spectrum disorder, and speaking of kids, you know, they're not in special education, you know, their peers may think they're a little odd, you know, but they're getting by. And you know, if you think about it, you know, there's no reason to think that autism used to be extremely rare and now it's as common as they're finding it is. So obviously these people were out there by and large in the past and they got missed. And they're still out there, you know, in their 50s and 60s, and they found ways to function, you know, little niches they could fit into in life, and they're getting by. And, you know, we can do that for people with the milder syndromes. More severe stuff where there's a lot of aggression and things like that, you know, there are some medicines they use for that. SSRI, serotonin reuptake inhibitor, antidepressant medications, and some of the neuroleptic medications that also work on serotonin, specifically risperidone and ziprasidone are the two that there's some research evidence for their use in autism.